Most people find that traditional medical care for people who suffer with the pain, burning, numbness, tingling, and cramping associated with peripheral neuropathy is rarely effective. I'm talking about the gabapentin, Neurontin, and Lyrica. Most people will tell you that after a period of taking those medications that at best, it only helped to take the edge off. Maybe it was enough for them to allow them to fall asleep. The problem, if you haven't already experienced it, is that these pills tend to become less effective over time for most people. You may have also noticed that these anti-seizure medications, yes, that is what gabapentin, Neurontin, and Lyrica are, they tend to make you feel loopy. If you think about it, that would make sense because these drugs are offered in an attempt to slow down your brain from perceiving normal sensations to the point that it does not process the actual damage that is occurring with neuropathy. The pills are given to make you more comfortable, but again, they're slowing down normal brain function. Now, I don't fault anyone for wanting to feel better or trying to do whatever is necessary, let's say, to get through the day or be able to sleep through the night, but I do have some concerns for people who are just following the traditional medical approach when it comes to neuropathy. The last thing I would want to do is slow down my brain from functioning normally. Second, is this approach, this traditional medical approach, is it anything to do with getting to the cause of the problem of, let's say, the pain, burning, numbness, tingling, cramping, and imbalance? Does it really get to the cause? You see, our exam is different because it lets us know what needs to be done to get to the cause. The exam we perform does not involve any needles. And yes, we hear it all the time that, well, my doctor says there is no cure for neuropathy and all I can do now is use this cane, walker, wheelchair. Our care has been responsible for helping many people either drastically reduce the pain, burning, numbness, tingling, cramping, and imbalance, or totally resolve it. And many who used to use a cane, a walker, or a wheelchair are no longer doing so after having received our care. People who could no longer sleep at night are now able to sleep through the night. Those who could not get through the day without suffering, those who were once fearful of falling, have now reported their lives changed after receiving our care. Again, it all starts with the proper consultation and exam. Now, feel free to reach out to us if you have any questions, because we here at Michigan Integrative Health, we wish you nothing but the very best.